Chris is here for cervical radiculopathy. We've been treating his neck, and he's been getting symptoms down into his arm because of stuff that's been going on in his neck. He's closer to the end stage of his rehab, so we've been working a lot more on like maintenance mobility, cervical neck flexor endurance, some periscapular strengthening in order to help maintain the gains that he's made. So he used to get pain all the way down into his elbow, and now he rarely gets pain, even with golfing, so it's been really good so far. We just need to make sure it maintains. That way as the spring months come and he's golfing more, he doesn't get those symptoms to come back. Okay, let's do a world's greatest stretch. So you're gonna go into a lunge first, here. I want you to like thread the needle and then open right up. Bring that right foot forward a little bit more so that way your hand and your foot are in like the same line. Yeah, perfect. And then open right up, perfect. How's that feel? Good. So today I just wanna do the row with ER. Yeah, so good squeeze behind the shoulder blades and then flip those palms up. Yep, perfect. Take it nice and slow, don't rush through it. We'll do 2 sets of 10 for those, and then we'll switch to the snow angels. I wouldn't say it's super often, but it is often enough where people mistaken their shoulder pain as something that's just shoulder pain. But I'd say that's the best part about like being in a really good physical therapy practice that values like evidence-based practice of like, you know, pain doesn't always come from where you're having the pain. So being able to recognize like, hey, this doesn't follow the pattern of like a shoulder or elbow that I would think it is, like let's check something above. And addressing that really made the difference. So I want to do that GHD extension where you're doing the chin tuck with it. Come down a little bit so that you're parallel to the ground, so even more. There you go, and hold that chin tuck there. Yep, perfect, 30 seconds there. For him, because we're working on his neck, there's only so many ways we can limit him on gravity. So although this is working hamstrings, a lot of like those posterior chain muscles, if he holds that chin tuck with it, he has to hold that chin tuck and like maintain his position. I'm big on if it can work more than one thing and benefit them in other ways, why not? Let's do, what's been the hardest one that we've done?
I hate bear crawls.
We won't do bear crawls today, but we are gonna come over here. So we're gonna do a tempo with them today. I don't care what your grip is, that's totally up to you. 2, 3, down. 1, 2, 3, while maintaining that chin tuck. So again, another neck flexor endurance. This will work on your back a little bit too, but that chin tuck with a nice RDL. So let's try 8 of them. If that weight feels too heavy, not heavy enough, we can modify. Chris, make sure you're getting more of a tuck and less of a flex. Yes, perfect. That's gonna be your circuit, is those 3.
Okay.
And then second circuit's gonna be even more fun. Always, it's always fun. It's always fun here. In this end stage, it's all about like getting them to be independent and getting them to be successful on their own after PT. So trying to give him options to build into the gym that he's already doing. I love a good chin tuck. When it comes to cervical radiculopathy, I love a good chin tuck. But it's an easy way because it varies against gravity every time you do it while maintaining that position. So obviously we don't live in that position, but we want to encourage some of those endurance muscles. So we're gonna do a suitcase carry, but what I want you to do is get like a really good tuck of the shoulder blade on the one side. I don't want you to just like open up your chest to get it. Like I want you to position that shoulder blade so that you're using like all of these muscles back here. I want you to think more about a tuck versus just like extending your shoulder. So tuck back, perfect, right there. Now walk. Good. How's that feel? Not too bad? Tempo push-up, chin tuck. So 3 seconds down, pause, 3 seconds up. Good, we got 8 of those. Next time we have a progress note, which will be a good checkpoint anyways, to like update your home program and everything. But yeah, talk to your wife, see what you guys want to do about like end of the year.
Okay.
Like I said, I think you could be successful either way if you want to trial some independent management and see how it goes. And then in the new year, if it's not going well, come back.
Okay.
Or if you're like, hey, like I feel really good and I know if I just get a couple more sessions in, like I know I'll be ready, we can do that as well. Yeah, so Chris is progressing really, really well. We're at the end phase of his rehab, so worked a lot on mobility, neck endurance. We worked a lot on periscapular strengthening and some of the neuromuscular control that goes along with that. Next time I see him, we're gonna end up checking his progress and seeing where he's at, but our end goal is get him ready to be done by the end of the year so we can enjoy the new year.